So, regarding this week's discussion post, the question was the DSM 5 system is based on pathology and the medical model of mental illness, whereas counseling is grounded in the wellness model. Why must counselors learn to diagnose clinical disorders? What are your thoughts and responsibility of diagnosing clients? That's just the first question. Um, I think there's a few reasons why that as future counselors we must and should be able to diagnose clinical disorders. Being able to provide the client some clarity about what may be going on is something that could be very beneficial to the client. Um, and it is a good way to kind of like build a plan and kind of further growth of the therapeutic relationship, at least in my opinion. Um, and it kind of just sets the groundwork to be able to treat the client in a manner that they need to get treated in. It does allow kind of like interaction with the psychiatrist if the client does need to be on medicine. But that's like a completely different bridge to cross. Um, it is important to note that just because a client does get a diagnosis, it does not necessarily mean that they have to go on medicine. I think that needs to be kind of clarified with clients that just because you did get a diagnosis, that's not the automatic, way to kind of solve this problem at the hand. So, our responsibility, straight from the book, calls for us to be ethical and to not harm a client. And I think it's important that when we do have to diagnose clients, that we're not kind of, um, for lack of a better word, beat around the bush about it. And it's something that we kind of need to take head on. And if we beat around the bush with it, it could lead to the client being harmed and like, oh, we're trying to kind of hide this from them, at least in my opinion. Um, there is one thing that does concern me about giving a client a diagnosis is if I said to said client that I think you have major clinical depression, the client might take that and kind of label themselves with that, and that could be harmful for their process. That could be harmful for their progress. Um, so I think it's important when we do talk about these things with clients, it's done with grace, and it's done in a manner that they can understand and they could take it for what it is, and that it's not like the end of the world. Um, One thing that's also important to note is that for like for reimbursement to happen with the healthcare or with like insurance and stuff like that, they may request a diagnosis. And from what I understand reading in the book, sometimes people diagnose for dollars, and you want to do what's best for your client, but at the same time, we're ethically bound to do the correct thing, which is provide an accurate diagnosis. And if the healthcare provider does kind of like request information, I think it's important to consult the client first before releasing this information to the healthcare provider, especially if the person that the information's getting to really doesn't work in this field and it's kind of just like in a management position. And moving on to the second question, the ethical issues related to the diagnosis of clinical disorders. What are some important considerations in regard to ethical responsibilities in diagnosis? Well, I kind of hit on it already. We're ethically bound to report accurately, and it's also ethically bound to kind of do what's right for the client. So it's important to work hand in hand with the client before um, they want to submit something to a healthcare provider, and it's important to kind of clear up that for them to get reimbursement, this may need to be this needs to be done, and if they're comfortable with that. Um, I think really overall is just taking the utmost care with the client can be done with like proper assessing in the early process of the therapeutic relationship, setting realistic goals, and complying with the care companies would lead to less conflict and, in my opinion, better results, which would end up bringing reimbursement for the client.